Okay, good afternoon to all of you. So today our demonstration is ECG, or it's also called EKG. Okay. So what is actually ECG? What is ECG? Can anyone tell what's ECG? Yeah, electrocardiogram. That's a full form of ECG. What is actually ECG? Yeah. So it's a graphical representation of representation of electrical activity of heart. Electrical activity of heart. So to understand ECG, we should know first the basics. So in order to understand basics, I have formulated the outline of this topic. So we will complete this ECG into 7 slides, or we can say 7 topics. Okay. First one is electrophysiology of heart. In electrophysiology, we will see the electrophysiology. Okay, via conduction pathway, we will see the conduction pathway, and we will see how the action potential of the heart is generated. As previous time, Dr. Yasin has nicely explained anatomy. This time I will not explain the anatomy, I will explain only the electrophysiology of heart. Okay. Then we will see there are some rules. Okay, we have to remember those rules, and we will see the basic experiment. We will do this experiment in order to understand those rules. Then third, we will see the cardiac vectors, how the vectors are generated in the heart, and how these vectors formulate the ECG. Then cardiac vectors to ECG. Okay. Then we will see the real ECG, the waves, segment, and intervals. Then timing and duration of the waves. Last, we will see the ECG leads, that's just a lead and limb lead. But this topic I will not discuss now because it will become very huge topic. So this, inshallah, next time I will discuss this topic. Okay. So now electrophysiology of heart. At the right atrium, we have SA node. We have SA node. SA node is a specialized myocardial tissue, okay, which is having the property of auto-rhythmicity, okay. So it's going to generate the electrical signals. It's independent of neurological, okay. The neurological, there is neurological influence, but it is independent of that, okay. That's why in a brain dead patient, still SA node is functional, okay. Then here we have the AV node, okay. From AV node, there is the left bundle of his, that's bundle of his, and right bundle of his, okay. From bundle of his, we have Purkinje fibers. We have Purkinje fibers. See, first we will see first the atrium part. Okay. See, atrium, it is actually small tissue. Okay, small tissue, and it is somewhat slow conductor as compared to ventricles. I will explain after a while all these things. For a while, you just trust me, okay? Then second is AV node. AV node is also a slow conductor. AV node is also a slow conductor because of one is size, and all these things I will explain. Then Purkinje fibers. This is left bundle of his, right bundle of his, then Purkinje fibers. And the ventricle is fast conductor, okay? And the ventricle is the bigger tissue as compared to upper atrium. Now, we will take the cross section of myocardium. Here we will take the cross section. We will take the cross section of this myocardium, and we will zoom the 3 cells. Are you getting me, everyone?
Yes, doctor.
Yeah, thank you. So these are 3 myocardial cells. Okay. This is the extracellular space. Extracellular space, and this is intramyocardial space. Okay. On the membrane of the myocardial cells, we have the channels. First one is we have the sodium ion channel. Then we have potassium channel, and then we have voltage gated calcium channel. Okay. And the resting membrane potential of the myocardial cell is 90 millivolt. It's the resting membrane potential. When there is an appropriate stimulus from the SA node, okay, the resting membrane potential, this stimulus, it will lead to the influx of sodium. And this potential, it will try to rise. When it will reach to the threshold potential is nearly 70 millivolt. It varies. What is the threshold potential? Threshold potential is the potential where the these channels, sodium gated ion channels, stimulate rapidly. Okay, so there is a rapid influx of sodium. Whenever there is a rapid influx of sodium, the negative charge, it will decrease. Negative polarity, it will decrease, and the positivity, it will increase. Eventually, it will reach up to +10. Up to +10. Okay. When it will reach up to +10, or we can see when it the line gains positive charge, so this channel will get stimulated. That's called a voltage gated calcium channel. It will, so the calcium influx is there. But remember, when there is stimulation of voltage gated channel, there is also stimulation potassium channel, but there is efflux of potassium and influx of calcium, efflux of potassium. So at some time the charge will neutralize, because see, potassium is fast channel as compared to calcium channel, and sodium is faster than these channels. Okay. And see, calcium it contains how many charges? 2 charges. Potassium contains 1 charge. Whenever there is influx of calcium, there is efflux of potassium. Since calcium is slower channel, and potassium is somewhat fast channel, but it carries double charge. So up to some time there is the neutralization of charge. So there will be the like plateau fuse. That is, there is no influx of charge. There is influx of charge and efflux of charge, but it's neutral. It is neutral. Why? Because there is influx of calcium and efflux of potassium. Okay. So both efflux and influx, they will neutralize the polarity. Okay. They will neutralize the inner polarity. So for some time, the line, it will tend to have an isoelectric. Okay. That's the plateau phase. Since the potassium channel is fast, it will tend to efflux out. It tends to reach downwards. It tends to gain negative polarity. When it tends to gain negative polarity, calcium ion channel closes, because it's a voltage gated channel. So there will be the again repolarization. This is the action potential. Okay. And the cells, these cells, myocardial cells, they are connected each other via gap junctions. Some of the sodium, they will leak from these gap junctions. And they will rise the that's called resting membrane potential up to threshold potential. Again, this cascade will. Okay, when there is a threshold potential, sodium channel, it will stimulate. There is a rapid influx of sodium, and it will reach up to plus 10, it will gain polarity, then voltage gain ion channels will stimulate, there is an influx of calcium and simultaneously efflux of potassium and light. So this will again maintain action potential. Okay, same this. Okay, this cascade will go on. So this is the depolarization. This is the depolarization. This is the plate phase and again repolarization. Okay, so this is the action potential. This is very important in order to understand the ECG. Now we will. I will try to explain some of the rules. You should remember those rules. You got this concept?
Yes, doctor.
Anyone have confusions up to now? See, remember, ECG machine, it works on the principle of, ECG machine works on the principle of, can anyone tell? Galvanometer, okay, galvanometer. What is galvanometer? You have heard this in physics plus 2, okay? Okay. So ECG machine, it works on the basis of, on the principle of galvanometer, okay? See, again I will draw the heart here. And remember one point, I forgot this point. This septum, okay, this is called fibrous annulus. Fibrous annulus. And this is insulator. It acts as an insulator. The gateway for passing the electrical signals from the SA node to ventricle is AV node. Okay, AV node. So this is the fibrous annulus. It acts as an insulator. Okay. So this is our heart. I will take first. I will tell you the rules. Okay. See, whenever there is direction of a positive charge, towards positive or towards, we can say, positive terminal. Okay. Okay, positive terminal of a galvanometer, okay, or any positive terminal. We have two terminals. We have negative terminal and positive terminal. Whenever there is a deflection or direction or movement of a, or we can say flow of charges from positive end to positive end, the deflection is positive. The deflection is, here I will apply the galvanometer. Okay, the deflection is positive. It's positive and it's negative end, okay. So deflection will be, this is the neutral point, okay. The deflection will be positive. So this is the first rule, rule number first, okay. Then second rule. If suppose negative charge will move towards the negative electrode, again deflection is positive. Deflection is positive, okay. Again deflection is positive. The third rule. Is whenever there is complete depolarization, complete or resting membrane potential, that's repolarization. Complete depolarization or repolarization, the deflection is neutral. This is the third rule, okay. Fourth. Okay, I will tell you one thing. Do you know this law? Do you know this formula? Yeah. Resistance is directly proportional to length and inversely proportional to area. When area increases, resistance will decrease. Okay. When area increases, Resistance is decreased. Okay. For example, we have this myocardium. We have this piece of myocardium. Okay, we have this piece of myocardium. Its thickness is less. Its thickness is less. The vector will be generated. The vector that will be generated, that is having very less magnitude. That's having very less magnitude. Okay, because resistance is inversely proportional. When there is when the area is when there is when we have greater area, resistance will decrease and we have bigger amount of current. Okay, so this is rule number 5. Okay, rule number 5, we have when there is movement of a cation or anion towards opposite side of electrode. For example, this is the positive charge. It moves towards negative end of electrode. Deflection will be negative. Deflection will be negative. 5th rule. Then 6th rule. See, I told you here that this atria, it's somewhat small. It conducts electricity slowly as compared to ventricle. Okay, ventricle is fast conducting and atrium is slow conductor, and AV node is even slower conductor. Okay, so see here we have galvanometer. Okay, this galvanometer we will apply to atria. Okay, because this is this is slow conductor. It can deflect the needle slowly. See, it can deflect the needle, but slowly like this. Okay, and when we apply galvanometer to AV node, it is that much slow, even it cannot deflect the galvanometer. So we will tell that AV node is whispering, it's not talking. Okay, then ventricles produce, ventricles are strong, fast conducting, because they have the Purkinje system. I will tell you the reason why this is slower, this is faster, this is this. I will tell you. And so the deflection will be faster, like this. Okay, deflection will be faster. These are the 6 rules. Okay, you should understand before ECG. Everyone understood these rules? Okay. Okay, we will go. Now I will tell you why this atrium is slow conductor, ventricle is fast conductor, and AV node is again slow conductor. I will tell you. First, this atria. So we will take the cross section of atrium. Okay. So this is a cross section of, for example, this is the cross section of atrium. Okay. In atrium, myocardial cells are small. Myocardial cells are small. Myocardial cells are small, and the junction, that is the electrical window between the adjacent myocardial cells, is less. Okay. So in atria, the myocardial cells, actually the first point is that atria is smaller as compared to ventricle. This is the first point. Second point, atrial cells are small. Okay, and they are having less electrical windows as compared to ventricles. That's why this is slower conductor. This is slow conductor. Next, we will see AV node. We will see AV node. This is the AV node. See, AV node, see, here are few cells. In AV node, this is a special other type of myocardium. It's having so many cells. But these cells are very smaller in area. Okay. These cells are very smaller in area. Again, one point I will tell you, the depolarization of atrium is sodium ion dependent. Is sodium channel dependent. Sodium is first, okay? Sodium is first. Sodium ion channel is first, okay? This you remember. And this AV node depolarization is dependent upon calcium. Okay, this is a very, very important point. That is why whenever there is the junctional arrhythmia, drug of choice is calcium channel blocker. Okay, okay. Whenever there is myocardial or atrial arrhythmia, which drugs we will give? Sodium channel, because the atria depolarization is dependent upon sodium. Ventricle depolarization is dependent upon sodium. Only SA node and AV node depolarization is dependent upon the calcium. Okay, this is entrance point. Note down this. Okay, and calcium is slow. Calcium ion channel is slow as compared to sodium. First point. Second point, here are many cells are here in AV node. There are many cells. Okay, and this AV node is also small tissue. And another point is that the resting membrane potential of AV node is minus 60 millivolt, whereas here atrium the resting membrane potential, and in the ventricle the resting membrane potential is minus 90 millivolt. Which is most electronegative, minus 60 or minus 90? Which will attract first? Which will attract first? For cations, for positive ions, minus 90 will attract or minus 60 will attract? Minus 90 will attract. That is why this is first conductor as compared to this. Okay. Now ventricle. See, in ventricles we have specialized tissue that's called Purkinje tissue. That's called a bundle of his Purkinje tissue. All these things. See, if I will draw the cross section of Purkinje cell, it's like this. Here are very few cells. And the electrical windows between the adjacent cells are more. Here electrical windows are more. Cells are less. The lesser the cells, if the length is less, less is the resistance. Okay, less is the resistance. Okay, so that's why this is the first conductor, and also it's having minus 90 millivolt resting membrane potential. That's why it's having its first conductor as compared to M1. Okay, do you got it? Okay, which is first conductor in the heart? Which part of the tissue is first? Ventricle. Then, which is slow? AV node. You tell me. The SA node and AV node is on which ion channel it depends? On which cation? Depolarization it depends. Tell me. Depolarization of SA node and AV node depends on. Tell me. You tell me. Yes. Yeah, good calcium channel. Okay. It's depend on the calcium channel. Now we will do an experiment. You remember these rules? Do you remember all these rules? You tell me. You tell me two rules. Just tell me two rules. See, lecture is very big lecture. If you delay, then it will go up to 6. Just tell me first. See, when you understand this, I will guarantee you will understand the ECG. Okay. Tell me. You tell me, Rajesh.
When the positively charged ions are moving towards the positive terminal, then the deflection is positive. When the negative charges are moving towards the negative terminal, the deflection was positive. When there is a depolarization or repolarization, deflection will be neutral. Then the area of myocardial, if it is less, then there is more resistance. Yeah, that's one. Then if positive charged ions are moving negative, then deflection is negative. The next one I didn't get properly.
Next one is the conduction system, okay, deflection, okay. For slower conducting, the deflection is slow. For fast conduction, deflection is fast. These are 7, okay. Now again, I will take one piece of myocardium here, okay. So I will take one piece of myocardium here. I will take one piece of myocardium, okay, and I will apply galvanometer on it. Positive terminal and negative terminal. When this myocardium is on, resting membrane potential, deflection is neutral, deflection is neutral. When there is appropriate stimulus, okay, then this cell will get depolarized, okay. Then via gap junctions, the sodium ions, they will enter into the adjacent cell and they will rise their resting membrane potential up to threshold potential. Then sodium channels, they will stimulate, and there is influx of sodium, okay. Whenever there is the rise of this up to plus 10, then voltage gated, okay. Calcium will there is influx of calcium, and when there is influx of calcium, there is flux of potassium. So they will there is for some while, sometimes there is a flight phase, and again because this is fast channel, it will tend to go repolarization. So first it will stimulate this cell, okay. Okay, the direction, see the direction. The direction is like this. The direction is like this. This is the flow of ions, positive ions. Flow of positive ions. That's okay. And flow of positive ions, they produce electromagnetic force. The flow of ions, this is all physics, okay, +2. Flow of positive ions or negative ions, they will produce electromagnetic force. And we know force is a which quantity? Is a scalar quantity or vector quantity? Vector quantity. And vector quantity we can represent by a direction. So the direction of current is this, okay. This is the direction of current, and it carries positive towards, okay, in its head, okay. Same, I am repeating these rules, okay, these rules. Second, so it will produce the vector, the direction of vector is towards positive, and deflection is positive. Second here. What is this? This is completely depolarized tissue. Does it fluctuate the needle? No, it doesn't fluctuate the needle. So neutral, the needle will remain at neutral position. Okay. See, when this is the completely depolarized tissue, the side which depolarized last will repolarize first. Okay. This side, this cell, it depolarized last, so it will repolarize first. So like this. Now there is flow of negative ions. This is flow of negative ions. From which? From negative to negative. Deflection is again positive. Okay. is the flow of charge. This is the flow of charge of positive ions toward us. Deflection will be negative. Deflection will be negative. So these are the rules. Same. I am repeating. One more rule I will tell you to explain why diagrammatically. See, this is the area of this myocardium is that much. Okay. When this will get depolarized, okay. This is the depolarization. Okay. It will produce vector. It will produce vector. But remember that vector, this vector, it is proportional. It is proportional to the. It's proportional to the area, or we can say it's proportional to the power of electromagnetic force. Okay, power of electromagnetic force. Okay. That again, it depends upon the area. It depends upon the area. When there is increased area, there will be more ions. There will be more flow of ions, and it will increase the intensity of electric current. Okay. So what I am trying to understand you that, see, this is thinner myocardium. This is thinner myocardium, and this is thicker myocardium. Okay. When this thicker myocardium gets depolarized, it produces a strong vector. It produces a strong vector. Here it produces weak vector. Here it produces strong vector. Okay. So this you remember. Okay. The vector, the magnitude of the vector is proportional to the power of electromagnetic force. That depends upon area and also the size of the tissue. Okay. So these are the rules. Now we will see the actual cardiac vectors. What are the vectors which are generated in our heart during one cardiac cycle? You remember the cardiac cycle? Next class I will not discuss. This is the last if you want to learn, then I will discuss today only. If not, then I will discuss the class. You are getting bored.
You are going to discuss these things also, no?
Yeah. Cardiac vectors, then ECG, then the timing and duration.
Next class you do it.
Okay. Till now, what you understood? Till now, I will ask some questions. Okay. If you give me answer, then I will discuss it. No. Yeah. You tell me, bro. You tell me two rules. Any of two rules you tell me.
Negative and unexpected negative. Positive.
Yeah, Dr. Sudeshna, you tell me the ECG machine, it focuses on the principle of galvanometer. Okay, you tell me now which ion channel is more fast and which is slow. Slow. Okay. Now Hemming, you tell me. Depolarization of SN node and EV node, it depends upon Okay. Junctional arrhythmia. Whenever there is a junctional arrhythmia, drug of choice is transmission blockers. Okay. Yeah. Yeah. You tell me, Yasin. Where is Yasin? Resting membrane potential of AV node is
AV node -60.
minus 60. Okay. So these are all influence points. Okay. Wish you best of luck for your NAPLEX exam. Okay. Thank you.